Hi, everyone. Thank you for spending some time with us this afternoon. My name is Andrew Phelps. I'm the director of the Oregon Office of Emergency Management. Earlier this month, Governor Brown convened the coronavirus response team and called for the activation of the state's Emergency Coordination Center to direct the statewide response to COVID-19 or the coronavirus. What does this look like operationally and in practice? Emergency management generally is behind the scenes supporting our first responders, the police, firefighters, and EMS workers that we typically see operating in our communities during disasters. So I want to take a moment, if I could, to explain how we're using the state's Emergency Coordination Center to support our statewide response. OEM typically serves as a bridge between local, county, tribe, state agencies, and our federal governments to provide resources and supplies to support our communities in times of crisis. We do this through our 18 emergency support functions, or ESFs. These are functions like transportation, energy, public health, communications, law enforcement, and fire response. Each of these emergency support functions is led or co-led by a state agency. While our emergency management system regularly responds to disasters such as fires and floods, the COVID-19 pandemic has certainly tested our capacity to respond. All 36 counties, all 9 tribes, and every Oregonian is being impacted by this outbreak. Right now, one of the most important tools we have in our toolbox to combat the spread of COVID-19 is personal protective equipment, or PPE. These are the gloves, masks, gowns, and other equipment that hospital staff and frontline healthcare workers are using to protect themselves and their patients. Now, typically a hospital would order the supplies they need, including PPE, on their own. I think we're all well aware there's a huge supply chain disruption in the procurement and purchase and distribution of PPE. So the State Emergency Coordination Center is prioritizing the procurement and distribution of PPE across the state. I want to take a moment, if I can, to clarify how we're prioritizing and streamlining and distributing this critical equipment to those who need it most. Oregon had an initial stockpile of PPE. We have already sent out this supply to each of Oregon's 36 counties and 9 tribes. As of this morning, the PPE Distribution Center, which is a 189,000 square foot facility in Wilsonville, Oregon, is fully operational. This space provides flexibility to rapidly process shipments of PPE through the system with speed, effectivity, and efficiency. The ECC is coordinating with the Department of Administrative Services, the National Guard, and the Department of Public Safety, Standards, and Training to ensure that this facility is operational 24 hours a day, 7 days a week, as long as there is the need. I know we have supply chain issues. We're receiving PPE right now from 3 main sources. First have been the donations, the incredible donations from Oregonians across the state supporting that local response. I want to assure everyone that especially those who have made these donations, that these donations continue to support community level response. These are staying in our counties and supporting those frontline healthcare workers. We're incredibly appreciative of those donations and thankful, and want to ensure that if you still have something to donate, you're taking that opportunity to do so. The second input of supplies into this distribution chain is through procurement, statewide procurement. The Department of Administrative Services, or DAS, and their procurement staff are using emergency procurement procedures to purchase PPE. This is expediting the process by establishing direct connections with PPE suppliers for faster results. For example, over 135,000 N95 masks and over 300,000 surgical masks are expected to be processed through our facility this week. That is a direct result of state purchasing. When there's a high demand item like PPE that local entities aren't able to acquire themselves, staff in statewide procurement offices are assigned to research any potential vendors. We then vet those vendors for viability and place orders to fulfill those requests. We've had a number of folks request to donate resources, sell resources, or volunteer their time through the state's donation website for COVID-19. And we're dutifully calling each of those vendors, assessing their ability to support, and working with those vendors to make purchases when appropriate. The final input right now into our supply chain of PPE is through federal sources. The state ECC is working hand in glove with our federal partners with the Federal Emergency Management Agency. In fact, FEMA's had staff embedded in our ECC for the last 3 weeks to support this relationship. As the governor said, this process includes 140 ventilators that were shipped last week, something that all states are in need of, as well as hundreds of thousands of masks, gloves, goggles, and other protective equipment. We're supplying PPE to state agencies whose work requires close contact with people who may be sick. We're also providing these supplies to tribes and to the counties through their county emergency managers based on the population of their county and that county's percentage of confirmed COVID-19 cases. Once received, the counties who know their communities better than anyone are allocating and distributing those supplies where they're most needed and can do the most good. We're aware that the supply does not meet demand, and that's quite frankly why we're working the way we're working. And we're working continually with the federal government and the Oregon Health Authority to ensure that all PPE is safe, that it's mitigating the risk, and it's going to protect our first responders, frontline healthcare workers, and the families that they go home to. We want to continue to maximize and streamline our processes around the allocation and distribution of personal protective equipment as we all face this unique situation. These are really extraordinary circumstances. Many of us are exhausted, anxious, and I think we're all craving much more information than we feel we have. We all know someone who's been directly impacted by this virus. They've been laid off, they have a sick parent, or they're just stuck at home and feeling anxious and nervous. I get it. I'm going to be here regularly to share updates with you and provide with you what we as a state know. Here's what you can expect from me and the staff working within the ECC and the state's leadership structure. We're going to continue to make the best decisions we can based on the information we have. And we'll share that information that drives those decisions with you. So here's what we know today. We have 606 active cases in the state, and 16 Oregonians across 24 counties have already lost their lives to this virus. It's becoming increasingly clear that this virus is not an urban or a rural issue. It is not a red or a blue issue. Everyone is susceptible. All 36 counties in Oregon, every country around the world is susceptible to this virus. I mentioned PPE as one of the most important tools in our COVID-19 toolbox. The other, and equally important, is social distancing. It's one of the things that each of us can do to make a difference. I know we all want to help. This is something that you can do today to make a difference. And the studies show that social distancing is working. We already have facts and lessons learned from across the country and around the world, and we're learning more each day. Staying home is going to continue to play an important part in our role to contain the virus, and it's something that each of us can do. By taking action now, we're preserving local hospital capacity, and actually we're increasing the capacity of our hospitals and healthcare providers to serve. We're protecting our first responders, and most importantly, we're saving lives by implementing these measures. As a state, we continue to maintain focus on two things: to save every life we can by ensuring healthcare workers have the PPE they need to do their jobs, and to give every Oregonian the information they need to navigate this challenging time so that they can make the best decisions to protect themselves, their families, and people they've never even met before, simply by social distancing. I want to close before we move to the questions by acknowledging that I'm placing my trust in you as an Oregonian, as a parent, as the husband of a woman who works with vulnerable populations here in the state of Oregon. I want to earn your trust, and we're going to do that by being open and communicative. Many of us have to continue to go to serve sick populations, treat those who are impacted directly by this virus, and provide critical services throughout the state. I want to continue to earn your trust in leading our state's effort to stop this virus and prevent it from inflicting more harm than it's already done. Again, thank you for being here this afternoon. And at this time, I think we're going to open it up to some questions. I know I didn't answer everything, so if you have some questions, feel free to submit them through the online tool. Make sure we have that locked in. Okay.
some that shows questions. We'll start with that.
Yeah, print that.
I need green. Are you there?
Yeah. Yes. Can you hear me okay?
Yeah.
Thank you. I'm wondering if you can explain how many N95 masks and surgical masks we have or have used so far, and how many do we need? Can you also do the same for gloves and protective gowns?
So the question is, how many masks do we have, and how many do we think we're going to need? We've distributed hundreds of thousands of these masks. We can circle back and provide accurate numbers if you want to follow up with the Joint Information Center for some level of specificity on exactly how many masks, gloves, gowns, et cetera, that we provided. But the numbers are in the hundreds of thousands. I think the last number I saw for gloves, for example, was like 2.3 million pairs of gloves. So there's a whole bunch coming in. But we know that we're going to need a whole bunch more, hundreds of thousands more. Certainly, what we've distributed now will continue to burn through that as people become sick and continue to be sick. And we want to make sure that our healthcare providers have everything they need to treat patients and reduce the risk to themselves in that environment. So it's a big number. Hundreds and hundreds of thousands of N95 masks are still going to be needed, which is why we're procuring as many as we can on the open market, and we continue to request additional assistance from our federal partners.
Okay, I'll ask you about money. How much money does the state have to buy these supplies? Is it going to get more?
We don't have a set amount that we've been directed as a ceiling to this. The direction that we've received at the policy level and that multi-agency coordination group that we've established, which includes the Governor's Office, Department of Administrative Services, Department of Human Services, the Oregon Health Authority, the Military Department, and the Office of Emergency Management, has essentially said we need to spend what we can to ensure we have the proper equipment to protect our first responders and our healthcare workers. And we're going to keep doing that until we have everything we need. That's, of course, where donations become important. That's where the federal supply chain also becomes important to ensure we have as much injection of public personal preparedness equipment as possible.
So there's not a limit right now on how much you can spend?
Correct. We're buying what we think we need.
Okay.
And if you couldn't hear the question, I'm sorry, I didn't repeat it. The question was, is there a limit on our spending? And the short answer is, we're buying what we need. I also want to add to that, when I say we're buying what we need, this is not just an issue of ringing up a PPE distributor. There's shortages all across the country, and it's taking some effort, I think, for us to identify folks, companies, manufacturers that can actually support the demand. We're hoping that we're going to have increased supply, but right now we're buying everything that we can that's been made available to us to purchase.
We're going to Claire Withacombe.
Hi, one of my questions was already answered, but I was wondering, how long are you preparing for the pandemic to last? And how are you kind of predicting how much equipment you're going to need based on that projection?
Hi, Claire, thanks for that question. We're expecting that the pandemic is going to last a very long time. This is not something that we're expecting to be done in the next 2 weeks or even the 2 months. You can sort of see the projections from other states, how they've been handling this, other countries, how long it's taken them to meet the need. This is going to be a very long haul. We're in the first mile, I think, of what's going to be a marathon for us. We're really looking at our burn rates, how much PPE is being used kind of on a daily basis, a weekly basis by our healthcare providers. And we're estimating that this is going to happen. There's going to be this need for the next several months. And was there a second part of that question?
No, I think you addressed it. I wondered though, this morning we heard from healthcare workers who are really concerned about the fact that they need to keep reusing supplies, especially masks. I'm wondering if the amount that you are acquiring is going to be enough to keep workers safe.
Yeah, right now at the rate we're acquiring, we don't think it is. That's why we're turning over every stone we can and using every available resource to bring in more PPE. You know, it's wholly unacceptable, I think, to us as a state to put our first responders, our public healthcare workers, our doctors, our nurses in any kind of a dangerous or vulnerable position to treat people that may be suffering from this virus or the other health issues that are showing up at our hospitals. We're working nonstop to procure what we can as quickly as we can and get it out where it can do the most good. And that's going to continue until we're told by our healthcare professionals that they don't need any more.
Thank you.
Okay, Comrade Wilson.
Hi, can you hear me okay?
A little staticky, but give it a shot.
Okay. I was just wondering, following up to what Claire said, I mean, do we still need to be rationing masks? That's something that a lot of hospital systems are doing. Others are, nurses and doctors around the state are making their own masks. I mean, is this something that, given the shortages, that you recommend or needs to continue in the short term at least?
Thank you for that question, Conrad. The question was essentially, do healthcare providers need to continue to ration the supplies of PPE that they have? I think our guidance to our healthcare providers is make the most use of what you've got while you've got it. We certainly want folks to do that in a safe way. I know that FDA has been providing guidance on reuse of PPE and ways to maintain the efficacy of PPE. But again, that's really the goal of this statewide mission, to procure as much PPE as we can so that we're limiting anything that's going to put our healthcare professionals in a vulnerable risk position.
What is the current supply the state has, balancing with that against the demands that you're seeing? I mean, do we have a week, 2, 3? Do you have a sense of how much PPE there is statewide that's available?
Yeah, so the question was, how much do we have available statewide? Again, it's a challenging question to answer with any level of detail, only because so much of this PPE has already been pushed down to our counties and our tribes, and they're managing their supply. We're really just working to get all the PPE we can. I mentioned that we have about 135,000 certified N95 masks en route to the state today that we've purchased as a state, and 300,000 surgical masks. How long is that going to last us? It's hard to say, but we're not going to look at a number and say, yep, that's good. We're going to stop purchasing. We need to make sure that we have a supply chain that can backfill those counties and the hospital systems and care facilities within those counties until, like I said, they tell us we can stop and we can shut the hose off.
Can I ask one more question, or could I come back later and ask that?
We've got you, Conrad, and you sound good, so go ahead and ask.
Okay. There's been a lot of discussions about just the challenges with states having to compete against one another for things like N95 masks, ventilators, all the PPE equipment that's so vital right now. Could you just talk a little bit about some of the challenges? I mean, is Oregon sort of in a difficult position, being that it is a smaller state, compared to Washington, California, New York, Florida, some of these places that are turning into hotbeds or are hotbeds, and is that making it more difficult for Oregon's purchasing power to really get what it needs?
Yeah, so the question was, some states have been competing. There's anecdotal stories out there that some states have been competing with other states to purchase PPE, and that the bulk of the allocation or the resources are going to some of the states that have had the most cases or have been most dramatically impacted by the COVID-19 outbreak. I haven't gotten any feedback that we're in bidding wars or anything with Washington or California. We certainly look at those two states as our neighbors and understand that right now where we sit, those two states are dealing with a much bigger crisis at this moment, but we also know that we're not in any way, shape, or form at the peak of this for us here in Oregon. So while I understand the federal response is prioritizing some of those states that have the most immediate needs, it's incumbent upon us, and I think Governor Brown has expressed this through several conversations she's had with Vice President Pence and some letters she's written in our request that was granted for federal support over the weekend, to ensure that we're getting everything we are owed from the feds to help augment our state response. And again, we're calling every vendor who's submitted their name into our online portal, seeing what they've got and seeing if they have any we can procure, and if they do, we're buying it.
We have, let's see, Dick Hughes.
Hi, Dick.
Andrew, this is Dick Hughes. Can you hear me okay?
I sure can.
Following up on this morning's press conference, will there be a way to find out what the current situation is statewide as far as how much equipment is needed there? Or is it just going to be continue to purchase as much as you think that you can get?
Yes, so great question, Dick, and the question for those that couldn't hear it, when will we have kind of a better situational awareness picture on what exists within the state from a PPE perspective, and how is that going to drive our purchase decisions? Did I articulate that the right way, Dick?
Yes, thank you.
Okay. Yeah, so we're working to get much more granular detail, and again, a lot of this is being driven by the data that the counties can provide up to us. You have to remember, a lot of these county emergency managers, they're one-person shops who are trying to support thousands of folks in their communities and dozens of healthcare facilities. So while we want to make sure we've got a good picture of what's available in the state, right now the priority is get this equipment where it can do the most good. As this continues to progress, as we have a more consolidated distribution system at the state level, and I think as our local emergency management partners and public health partners become more comfortable with the process we're using to distribute this PPE, we're going to have a little bit more clarity on the level of detail of what's already been provided out in the communities. I mentioned the state supply chain, that we're procuring things and that we're taking donations. That's happening as well at the county level. People are donating supplies to the counties, so that's augmenting their stock. And we don't want to waste valuable resources and the time of our local emergency managers, asking them to count every pair of gloves and every mask that they've received, especially through the donation process. You know, we're acquiring a lot of resources. We're turning over every stone to see where we can find additional resources. But we know that the one resource we're not going to get any more of is time. So we want to make sure that we're using all of our time as efficiently and effectively as possible. And I think as this continues to progress, we're going to seek a little bit more clarity about what's already out there in the communities, what individual healthcare systems and facilities have. And at some point that might drive some of our purchasing and our decision making. But at this point, we're just trying to get what we can and get it out to the communities.
I'll ask just one other question. I sent in a whole bunch of questions that people can respond to when they have a chance in written form. But how do we know when the situation is getting better? Do we know how many people have gotten sick and have recovered? Do we are the numbers of hospitalizations being reported by the emergency command and number of ventilators, are those day-to-day numbers currently in use? Does that make sense?
Yeah, absolutely. Great questions. Dick's question was, how do we know when things are getting better, essentially? What are some of the metrics we're looking at to know if we've flattened the curve, right? So one of the key indicators, I think, are new cases. So as we see new cases pop up, that's an indicator that we're starting to continue to reach that peak that we've been talking about, that top of the curve. As we look at different data points, things like hospital bed availability, ventilator availability, number of positive cases, number of folks that have recovered, hospitalizations, those are all data points that I think are going to really inform the health scientists to let us know and provide with, I think, maybe a little bit more accuracy and detail what that curve is ultimately going to look like when we think we may hit that peak. And that's also going to drive decisions about what our capacity needs to be. So there's a bunch of data points that a lot of people that are a lot smarter from that public health world are looking at. I think what we can do, Dick, once we kind of have maybe a clear picture of what some of the modeling has been telling us now and what some of those data points might be, we're going to share that with everybody.
Thank you. Are you putting up more hospital step-down facilities now?
Yes, the question was hospital step-down facilities. So we have the 250-bed Oregon Medical Station here in Salem at the State Fairgrounds. We've been doing assessments as a state with our federal partners on several other facilities around the state that could be step-down medical facilities. And we would expect those to be assessed for their location, their capacity, what would be needed to make them viable solutions to be step-down facilities, but that's all part of our long-range planning process.
Okay, we got Daniel Growley.
Hi, this is actually Camilla with Fox 12 Oregon. Most of my questions related to PPE were actually answered by everyone else's follow-up questions. Are you also able to talk about the temporary suspension of the self-service gas station bans? Because I know we've been getting a lot of comments and concerns on that. Is that something we're able to talk about?
Hi, Camilla. Yeah, thanks for the question. It was about the pump your own gas which is you know, maybe a sign that things are really crazy. Yeah, so what I can do is provide some of the clarification that we released yesterday with the Department of Energy. This is not a ban on full service gas stations. We're not telling any gas station in the state that you are not allowed to pump people's gas. This was really meant to address the capacity issue and the staffing issues that have come up at many gas stations across the state. There were concerns from gas station owners that they weren't going to be able to meet the need of their customers because they had folks that couldn't come into work, whether it was dealing with childcare issues at home because schools are closed or people not feeling well, or just that anxiety I think that a lot of us are feeling and deciding that, you know what, being out at work right now, it maybe isn't what I need to be doing. So we wanted to address that issue with the gas stations and the fueling stations, and understand that fueling is a pretty critical part of our supply chain. So this was a step, an interim measure to be able to ensure that we can provide fuel to folks. I think it's some of the concerns were, you know, people touching the same pump, and that maybe seemed counterintuitive to some, but the clarifying message that came out yesterday, gas stations are not becoming free-for-alls. Gas stations are still required to have attendants to monitor the process, to assist those that need help, to wipe down and sanitize the hand pumps and the push-button screens that you use, and to make sure that social distancing is being practiced. So that's what we would expect to see. If folks aren't seeing that, we'd like to hear it. If it appears that gas stations are becoming a free-for-all, let us know, but I don't think that's the case. We want to make sure that folks are able to get fuel and that we're not putting any kind of constraint on the fuel supply chain by forcing closures just because a gas station doesn't have the staff to pump everybody's gas. Did that answer the question?
Yes, it did. Thank you.
Okay, we're going to Donald Ford. Donald Orr, are you there?
I think most of my questions were answered from my colleague Conrad, so I think I'm okay.
Thanks, Tom.
Yeah.
Jody Barron.
Oh, thank you. My question was answered using the chat box.
Great.
Jonathan Bach.
Hi, this is Jonathan Bach. Earlier you said that, you know, we're in the first mile of a marathon, that this is something you're not expecting to be done within the next 2 weeks or the next 2 months. This is going to be a very long haul. Are you basing that, is there any other information other than, you know, I think there was a study that came out that said if people stay in home, there could be, you know, 1,000 cases versus if they just completely ignore the rules, 15,000 cases. Are there any other data points that you're basing that, you know, 2-month or more estimate on? And then as a follow-up, you know, how do you feel emergency officials are prepared to run this marathon? Have there been experiences like, you know, Salem's water crisis that have helped prepare you for this unprecedented moment?
Yeah, so a two-part question. Thank you for that. The first part, where do we kind of come up with the idea that this is not going to be over in 2 weeks, but it's going to be a much longer event? And then the second, is this like anything we've done before, essentially, and how prepared are we to continue to respond to this crisis? So that the notion that we're not going to be finished with this in 2 weeks and it could last into months is coming from a couple of different things. First and foremost, it's coming from what we're seeing around the rest of the world. Despite social distancing measures, this virus will continue to linger. People are going to need to be treated. What we want to do is make sure that social distancing and some of those other measures we've implemented are mitigating that surge that we saw in Italy, that we're seeing now in New York, and we've seen other places around the country and around the world. That's not to stop this disease in its tracks necessarily. It's to flatten the curve and to spread out those who are getting sick over a much longer period of time so that our hospital system is not overwhelmed and we can treat the folks that need treating the most. The other piece of that, I think, is I'm an emergency manager. I'm not much fun at parties. I look at the worst case scenario and I can't plan as if this is going to be wiped out in a month or 2 months. I need to make sure that this system is set up to run for many, many months and that's what we're building. It's about, in a way, managing public expectation, right? So that folks understand that this is not something that on an arbitrary day on the calendar at this point, it's going to go away. It's not the case. We also know that we're, from what I understand, a year to 18 months away from a vaccine. That's going to make a huge difference, but that's a long time out. So emergency managers, we tend to look at things through that lens of how bad can it get, and that's what we prepare for. Now, the other side of that is, have we ever done anything like this before? Nope. This is my first time managing a statewide pandemic. But what we see are guideposts or navigational buoys that are very familiar to us. They're supply chain issues, they're long-term planning issues, they're medical surge issues, they're capacity issues. These are all things that are very recognizable to healthcare workers, to first responders, and certainly to emergency managers. So we're trying, I think, to find things that are familiar and recognizable and put them in the box that we're used to working with in a sense. 2 weeks ago, we've done something here at the State Emergency Coordination Center we'd never done before. We brought in an Oregon Department of Forestry incident management team to help manage the scope of this incident. I think if you would have asked me a year ago, would we ever do that? I probably would have said no, but it came very clear very quickly that this incident impacting 36 counties, 9 tribes, and 4.2 million Oregonians was not something that this structure could handle with our typical staffing patterns. So bringing in some resources that we know exist, that are very competent and work in an emergency environment, has been very helpful for us. And we've been seeing this mirrored at the local level as well. So yeah, first time with a global pandemic, but not first time managing supply chain issues and other issues that are popping up and causing a problem with this particular response. So we're trying to find things that are recognizable. And I would encourage you as Oregonians, folks that are listening to this, find things that are recognizable to you. What are some things that are part of your daily routine that you can maintain to help maintain some semblance of normalcy in your lives? This is disruptive for all of us. It's disruptive for local, state, and federal governments. It's disruptive for our families. So anything that we can do to find some level of normalcy, some level of things that look familiar, it's going to help us as we respond. And I think it's going to help the public get through this.
Okay, we have 2 more questions.
2 more questions.
Mila Mimica? Mila Mimica?
Hi, can you hear me?
Yes.
Great. So I was wondering, I know Oregon may be doing a little bit better than other states at this point. I know our hospitals aren't yet overrun. At this point with, moving off of regular scheduled surgeries, things like that, some hospitals are worried about staffing. They may have to furlough people. What's your response to that?
Thanks for that question. So it was Oregon isn't as bad off at this point as some other states. We're not seeing the surge issues that other states are seeing, but there's a concern that some hospitals may have to lay off some of their workforce. I don't know that I have any insight necessarily, or I haven't heard specifics about hospital systems or facilities that are laying staff off. We know that this is really difficult for a lot of Oregon's workforce. I'm hoping that some of the things that we're doing to increase our capacity to protect our healthcare workers will help alleviate some of that concern that we're having with healthcare centers and hospitals and clinics. Let me see if I can find some more information, and if we can circle back on that piece about the impacts of canceling things like elective surgeries. If you can call the Joint Information Center with that question, we'll make sure it gets to the right person. Thank you.
Awesome, thank you.
Okay, last question.
Last question.
From Susan Traxell.
Hi, it's Susan Traxell. My question is there an estimate on how long until we get more test kits in Oregon that could be processed faster than the current 10-day turnaround the private labs are taking?
Hi, Susan. Thank you for that. The question was, is there a timeline on when we're going to get those expedited testing kits that can test much more quickly than what we've been using? I don't know what the timeline is. I know that over the weekend, a manufacturer was starting to make available those test kits that it sounds like can provide a positive test in about 5 minutes and a negative test in 10 to 15 minutes. I don't have a timeline on when those are going to be made available, but on the call we had this morning with the White House, they indicated they are going to be pushing those test kits out to each of the 50 states. So we'll provide more information with that as soon as we know it. Great. Well, I think that's all for our questions today. I want to thank you again for your questions. And I want to thank you for helping us get some of this information out to Oregonians. There's a lot going on. I know that you all are becoming public health experts as you're developing your questions and asking us about the situation. So we appreciate that. We want to make sure that we're available to you to answer those questions. We've got the Joint Information Center that's operational. They're going to be fielding questions throughout the day as you have specific issues that come up. And I think we'll see you tomorrow. Thanks, everybody.